Hey everyone. Hey, I just wanted to make a short video today to talk about a couple things that have been on my mind lately, especially about mask mandates, dining facilities being shut down, those kind of things. The reason I'm doing the video is because I've actually tried to post a few news articles lately and some links that actually show what's going on with the vaccine, some of the negative side effects from it. And again, not to say that you shouldn't take the vaccine, but I'm always a big fan of everybody having the most information that they can have. So I think people should be able to see both sides of the story. What I've noticed, however, is that when I post anything, no matter what the data or the news article it comes from, no matter what it says, if it's negative in any way against masking or vaccines, it actually never gets posted. So if I look in my timeline, it'll show it was posted, but if you go to a news feed, it shows that it was never there. And I think it's doing its special algorithms and things to figure that out, and also looks at some of the links that I put in to share those things. One of the latest ones that I was trying to show was the number of countries in Europe that have banned the use of the AstraZeneca vaccine. And I think it's important for people to see that and see the rational reasons that these governments have decided to not use that vaccine. However, in the United States and Facebook, that gets blocked, and for what reason I cannot tell you. So what I want to talk about today is mask mandates, and also a little bit on having on-premise dining. And so on March 5th of 2021, there was a new report that came out. It was based on a study from the CDC called the Association of State-Issued Mask Mandates and Allowing On-Premise Restaurant Dining with County-Level COVID-19 case and death rates. And this was measured in the United States from March 1st through December 31st of 2020. And so what they did is this is a huge meta-analysis, and they took all the counties that had mask mandates, and what they did is they actually measured the number of increase, or decrease, I should say. So if you had a certain number of COVID cases and it was increasing at a certain rate, and then we had mask mandates, well, how much did wearing those masks decrease the rate of infection following those mask mandates? And then they did the same thing with dining areas that started to open up. And so they had the control, which was basically previous when they had a lot of restrictions and nobody was open. And then they tried to see, they wanted to look at what happened after they opened up. Was there a large increase in the amount of COVID cases they were seeing, or did they decrease, or what happened? And so what's happened is the news media ran with this, and the CDC came out and made their recommendations, and the news media came out and said, oh look, we have to continue wearing masks, we should be social distancing because this new study is out and it shows that there's been this increase in rates. So this meta-analysis was designed, again, to see if universal mask mandates would help reduce transmission of COVID-19. So again, the CDC, shortly after this study came out, they came out with their guidelines stating that we should continue wearing our masks and recommend that restaurants should possibly remain shut down because the study showed that wearing masks helped decrease the spread of COVID-19, and having open restaurants increased the spread of COVID-19. What percentage decrease do you think we should have found in this study? Do you think maybe there should have been a 75% decrease in the caseloads? 50%? What about even just 25%? Where do you think that we should be as far as decreased caseload to continue justifying that everybody needs to wear masks all the time? Well, let's go ahead and dig in and look at what the charts and the analysis actually showed. So what they did show was that mask mandates were associated with a decrease in daily COVID-19 cases from 1 to 20 days, 21 to 40 days, 41 to 60 days, 61 to 80 days, and 81 to 80 days after implementation. So how great of a reduction did we see when we looked at the charts? And we see that what we did see is that 20 days following the mask mandates, there was a 0.5% decrease in the change in number of cases. At 21 to 40 days, 1.1% decrease in the changes of the growth rate. So let's just skip all the way down and go all the way down to where basically we were 81 to 100 days after mandating masks was implemented, and what happened there, and that was the highest increase, and that was 1.8%. So that means 98.2% of the time the masks did nothing to actually decrease the caseload. So let's look at restaurants being open. What does that look like? Well, they did the same thing, and again, they measured these things at 41 to 60 days, 81 to 100 days, all the same things that they did when they did the mask mandates. And so what it showed was that they saw 120 days afterwards, the cases actually decreased by 0.4%. And then at 21 to 40 days after we saw the opening, the case rate actually decreased by 0.1%. Now after that, we had 41 to 60 days, 61 to 80 again, and 81 to 100 days. And what did we see in the increase of cases? We did see an increase, but what was the most? It got up to 1.2%. So that means that basically shutting down the restaurants has saved about 1.2% of cases. Now, if we look at these numbers, I think we all have to agree that the first thing, when you see such a small percentage changes, you'd have to do a study like this for years to actually attribute that increase in caseload to either wearing masks or opening restaurants. And they keep saying, again, follow the science. Well, this is the largest science study ever done on this. And what did it show us? It showed us if we do these things they recommend, that at the best, we're going to get a 1.8% reduction in the number of new cases of COVID-19. Now that doesn't take into any account all of the negative side effects and impacts that follow these recommendations. There was a study that came out earlier as well from Denmark. They did a controlled trial where half the people wore masks, half the people didn't wear masks. And what did they find? They found that the people that wore masks didn't do any better, statistically significantly better, than the people that did not wear masks. And they weren't just wearing any mask, they were actually wearing medical masks, and they gave them several masks, enough masks they could change them 4 or 5 times a day. And the people that weren't wearing masks never wore masks. And again, there was no statistically significant difference between the two groups. That means that they didn't see a decrease in caseload that was statistically significant to justify wearing masks all the time. I'll leave it up to you what you want to do and what you think is best for you and your family. And I don't judge anybody for that. I don't judge people if you want to wear a mask, if you don't want to wear a mask. If it makes you feel safe and it protects you, then go.